Welcome to Nothing to Fear podcast. I go by the name Chris Blanca Pro. I started this podcast to share my untold story, my truths, and my journey, and my close relationship to Jesus Christ. And I want you to create a life on your own terms. We always have a choice. This podcast is about career, hustle, perseverance, manifestation, fun, sport, entertainment, relationship goals, and making it happen on your terms.
Hey, welcome back to the Nothing to Fear podcast. It's the people's podcast, of course. Well, today, it's been a long time coming. You know what I mean? I know her for over, I would say, 2 decades. Like, seeing her around till I get to know her. And she's a very phenomenal person. You know what I mean? She carry a lot of caps. I mean, she's going to say it all to you all today. Shari, Dr. Shari.
Hi.
How are you doing?
I am blessed
Thank
and
God.
highly favored.
Thank God.
hmm
How your day going so far?
Day has been good. You know, I've had a few setbacks at the beginning of the week,
Yeah?
but we keep going.
Every setback is for something great, right?
You know, I saw a video today.
Yeah.
Actually, Ciara, the artist,
Yeah.
and she said she was so stressed, and her husband went, "No, you're not so stressed. You're so blessed."
Okay.
Because it's those experiences, whether it feels like a lot, it feels overwhelming,
Mm-hmm.
it's really all blessings.
Of course.
So that's why I'm like sure to tell you I feel blessed.
Yeah, you got to take it gracefully, right?
Yeah.
Like,
Mhm.
like that's what it is. So, you carry so much cap. She is a doctor, medical doctor, emergency room. Don't forget that. She's a businesswoman. She's a fitness instructor. And she's going to tell you about the rest. So, we're going to talk about your upbringing first. Because we want you to lay it out there so people can understand where you're coming from. A little bit. Not everything, but a little bit of everything. They could read the rest in this book. You know what I mean?
Yeah.
And
you
she's an author. She's an author too. You know what I mean? She's an author too. Author. Can you take us back in your early years? When you were a child, your childhood years?
Yeah, of course.
Mhm.
So, I mean, Brooklyn raised me. I'm
Yeah.
born and raised in Brooklyn. Obviously, I'm still here.
Yeah.
But I am Caribbean also. So even though I was born here, my parents are from Grenada. My dad is from the mainland of Grenada. My mom is from Caracou. So I have to big up the kayaks because she's going to tell me, don't forget.
Yeah, don't
her
forget
people.
that. Big up the Caracou people.
That's right.
Big up mom. Oh,
Definitely.
Yeah.
But, you know, 2-parent household. I have 2 brothers. I'm the middle child, only girl. So I'm used to that family unit and also the dynamic of what it feels like to be a sibling,
Yeah.
to have someone to look up to, but also to be a model for who's coming behind me as well. My parents raised us in prayer. They raised us to be dignified. They raised us to have integrity, and that's the upbringing. That was the foundation.
The core Caribbean morals.
That's right.
Guard. You know what I mean? Don't forget that. Were there any moments or people in your upbringing that helped you shape you into the woman you are today?
Yeah, I mean, I would definitely say my mom. My mom, and I know it sounds cliche, but when I say my mom is like the perfect model, I mean it. Like she's who taught me how you can be powerful even though you're quiet. You know, that quiet control, but she's the perfect example of resilience. You know, she made sacrifices for her family, for her children. She is a financial genius. She's an entrepreneurial spirit. I think I got a lot
from her.
Yeah. My dad, he's all about hustle. You know, the Caribbean man, they just keep going after it. And if you can't figure it out, figure it out.
That's it. There's
That's
no
how
other
my
ways.
dad is. So I got my heart and my hustle from mom and dad.
What's mom's name?
Her name is Sharma.
Sharma. Shout out to Miss Sharma. That's how we do it in the islands. We show respect. We put that mistress in front of them, Mrs. Sharma.
That's right.
So did you always envision a future when you were to wear so many hats?
Yes and no. I mean, And when you read the book, you'll see, like, I've always had this dream of becoming a doctor.
Yeah.
And then in school, somehow I had a natural affinity to like the sciences and math more than any other subject. So it kind of just all kept aligning as I got older and older. So I knew that that's what my goal and my dream was. But when you say all of these hats, I'm like, no, I didn't think so. I didn't think that I didn't pursue in my mind, I want to be a business owner. I didn't think I was going to be an author. These are just things that, again, through the natural progression as life went on, experiences continued to happen, that I just continued to evolve.
And you keep listening to what's coming up here. Like,
yeah, and following that.
And following that.
Yeah.
Yep. So we're gonna touch becoming a doctor. Let's touch a little bit about becoming a doctor. What challenges did you face in a medical school or in your practice, and how did you overcome them?
Yeah, I mean, there's a lot. I even touched on a few in my story, but I think what comes, I guess, the most or to the forefront of my mind is that, and it's not even about like patient care, because there are cases and challenges that one can face every day on any shift. But in like med school or even trying to get into programs, the challenges were many. It's like my interview skills, I had to develop that and learn the hard way. And I talk about that story as well in my book. When it comes to getting into residency, it's having a child, being a new mom, and making decisions based on that. Like there were so many challenges along the way, but this is again where faith comes in, where resilience comes in, and where heart and passion come in as well.
And perseverance, and it's all in here. So you guys can go purchase your copy, please. It's on Amazon. Support the community, support the power. You know what I mean? So how has it been, a doctor, influence the way you approve others' area of your life?
Not only just being a doctor, but just understanding like our culture, even the Caribbean culture, like identifying, having that cultural competence to identify like what struggles and challenges our people face, right? So, you know, like let's just take the example everybody understands. Living in the Caribbean, people eat good food. You know, they're healthy. They're probably the most healthy. Like they live long. When I say live long, like my grandmother, she lived until 92, 93 years old, right? So like you wonder why when you come to America, we have diabetes, high rates of hypertension, high rates of cholesterol, all of these issues all of a sudden. And you'll say, but I'm eating the same foods that I've eaten.
It's not the
but
same.
It's not the same. It's not the same.
Never the same.
There's processed foods, there's sedentary lifestyles. They're not going out being active.
Preservatives.
Right? So my experiences as a physician and just hearing people's stories and just hearing anecdotally like what people are experiencing, putting it all together, there's research that supports that, you know, it's all about how we're living. And I think having that lens, not only from the background that I have, but now the professionalism that I've earned, it's like it's giving me the empowerment to say, now I could deliver this information to others and help others and give them that insight. So that's one way, I think.
Of course.
Yeah.
We never touched the topic of her being a mother, being a single mother. I mean, I know there's a lot of challenges with all the stuff that you have to do. Plus, you know, you have a child, which I happen to know him from he was like
born.
You know what I mean? Colin, shout out to Colin. You know what I mean? Very talented kid. You know what I mean? So being a single mother, we're gonna touch on that. What has your journey as a single mother taught you?
I'm not gonna cry. I'm not gonna cry. But nobody plans, well, maybe some people do these days, but I didn't plan to be a single mom. It's just the cards that life dealt me along the way, and that's fine. But being a mom to Colin healed me.
Yeah.
Do you know what I'm saying?
Of
Like,
course.
it's the help that I didn't know that I needed.
Yep.
He might be grateful that I'm his mom and everything, right? But I'm grateful that he is my son.
Of
Like,
course, and I know that firsthand. He's
listen,
grateful.
he makes me proud every day.
Yeah.
He literally taught me how to live better, how to be better, and how to keep striving for more. Like, before it was about me, and then now it's about me and the legacy that I want to leave for him, you know?
Of course.
And that's growth all in and of itself.
Of all this work, come on. Come on. Colin is the perfect kid for this. You know what I mean? Very humble kid. And I mean, I know him personally. We talk. You know what I mean? I watch him grow in my chair because I cut his hair step by step. You know what I mean? Shout out to you. You did a great job. You know what I mean?
Thank you.
How do you manage the balance between motherhood and your determination professional life?
You know, there's no such thing as balance. And that's why I titled the book Find Your Pulse, because I feel like, first of all, your pulse rate is never the same. It changes second by second, minute by minute, right? And also depends on what you're doing.
Of
So what
course.
happens when you start running? Your pulse rate goes up because you're trying to meet the demand that you're placing on it, right? When you're sleeping, your pulse rate might go down because now it's time to rest, right? So when we say balance, it's like people are always striving for balance, but there's no such thing. It's about staying in a rhythm, right? So if I'm running fast, I want my pulse rate up. I don't
Yeah.
want it to be slow. You know what's going to
of
happen?
course.
I'm going to end up on the floor.
Of course, who's
So-
the perfect person to say that?
So there's
The
no
doctor.
way. There's no way to find that balance. But
Yeah.
what we need to find is a rhythm. Like, what needs our attention right now? What do we need to do for that right now? What could we put on the back burner? So that's like one of the main lessons that I wanted to put out there. Sometimes we have to be still. Always, we have to be still to feel our pulse, to know where we are. Like, if I'm trying to check my pulse, I can't do that while, right? You have to sometimes rest, think, meditate, and check your rhythm, see where you are,
Of course, and stay the
Yeah.
course.
and stay the course.
Of course. What message do you want to pass on to a single mother who may be struggling right now? What is it?
That you're not crazy. You are not crazy. It feels like a lot. It's a lot of pressure, a lot of expectations, and I want people to feel seen. You know,
Of
like,
course.
people think that they're going through their struggles and they're the only ones. Why me, God? Why me? But the purpose of telling my story is being vulnerable so that someone can relate to that and find safety in that.
Of course.
Because then they'll feel empowered to do the things that they need to do to get out of that. So that's the message. You're not crazy at all.
You're not. I'm going to second that. You're not crazy. You could do it.
You can,
Of
absolutely.
course, you can do it. So we're going to get to the good part now. The book. Author. Book. I never would know that. I mean, anyone could write a book. But not everyone could tell a good story and tell the story on point. I never would imagine that I will be buying Dr. Shari Anjo. She's an MD. She's a medical doctor. Don't overlook that, please. So we get into the book. What led you to become an author, and what inspiration you behind your book?
Yeah, so I think there's power in storytelling, and I think that people look at me and think that it came easy and it's all perfect and she could do it, but I cannot. And again, through me being vulnerable and letting people see that I am not perfect, that they can too follow their dreams, go through their struggles, come out on the other side, that telling my story is not only for me to know, but for others to appreciate and pull from. So even though I'm telling my story, it's not a full memoir. I'm actually trying to deliver some advice. And I frame that around the vital signs that we learn in medicine: your pulse, your temperature, your oxygen saturation, all of that. It's relatable to the many things that we should be focused on in life to find our rhythms, right? So that was the inspiration, because I get a lot of stories from people. I hear a lot of, things from people where they're feeling inspired and or they might feel down and they might feel like they can't accomplish certain things and they need that empowerment. So That's why I wrote it.
And I'll be honest, I started reading the book. I'm not quite finished yet. I'm like midway in the book, and the table of content is what caught me off the rip. Like, she's a doctor. She's not only a doctor. When she say, find your pulse, you gotta understand, it's all in this book. Please go purchase your copy, and it's right there. If you're struggling as a single mother, or it's a unisex. It's both sides. You know what I mean? Sometimes we have to slow down and listen to what the ladies have to say as a male. And I'll be honest with that. So we're gonna take a break, and we're gonna be right back after this.
Okay. So I said, well, tell me why you think you have no appetite. I feel nauseous. I was playing baseball with my grandson about 5 days ago, and I tweaked my back. First of all, this woman looks amazing. She's 87 years old. She tells me she's playing baseball. My eyebrows immediately raised, like, what?
87.
So I guess she was like playing pitch, back and forth with her grandson, and she said she tweaked her back. She strained her back. So over the time of, she's dealing with that, she said the back pain kind of came around to the front. So now her stomach feels upset, like nauseous. So she has not been eating and drinking. So she went to urgent care, and they told her to go to the ER so she can get IV fluids. So that's what she says. I'm here for IV fluids.
Yes, because it's probably the excursion pain from her back.
Yeah.
Travel all the way around here.
So I examined her. Her exam is normal. She's not tender anywhere. She looks good, but she just looks uncomfortable,
Yeah.
So I ordered some blood work and some urine. I gave her something for her nausea, something for her pain, something, just to help her while we're waiting on results. And results look normal. Everything normal. EKG, I even did. EKG normal. Everything's normal. And I go back to her and I say, how do you feel? And she's like, I still feel nauseous. So I said, listen, I don't think your back pain is related to your belly pain or your nausea. Something more must be going on. I was hoping to find something, but I didn't find anything. So is it okay with you if I pursue further? She's like, no, I just want to go home. I'll get a heating pad. You could prescribe me the nausea medicines. You gave me a bag and a half of fluid. I'm fine. I said, I don't feel comfortable sending you home. I said, if you were my family member, I would want the doctor to do more, right? So if you don't mind, allow me to do a CAT scan, because I just have a feeling there's something wrong, right? So then she's like, well, what could be wrong? I said, have you ever had any surgeries? No. She's no medications, no surgeries, no medical history. When I say healthy, this woman is tip top. So she agrees. I explained to her, she's like, what do you think it could be? I said, you could have a blockage. You could have something early, an infection. We don't know yet. I think it's worth looking. So she agreed. And then her sons came and they agreed too. So we did it. And she's wheeling by. They're wheeling her past me on in the wheelchair, and she waves to me, and I'm like, hi, And when I say she looks good, but she's telling me she doesn't feel good, and that wasn't sitting well with me.
It wasn't sitting well. You're not letting her leave there without do a proper thoroughly check.
Yeah. So then they called me into CAT scan, and she tells me, like, she's not sure she wants to do it. Why would I have a blockage? I said, there's a small chance that you could still have a blockage even if you've had no surgeries, if there's a mass, if there's, something going on. So scan was done, and this woman had a mass in her intestines that was causing the intestines to telescope onto itself and cause a blockage. She needed emergency surgery. Imagine if she went home. And that's just one case. And I honestly feel like, and I don't want to sound crazy, but I feel like it's prophetic. Like something, intuition is telling me when something is wrong. Yes, I have the knowledge. I have the wherewithal to say A plus B equals C. That's
why you see when you get it here, when it comes here, you never ignore it.
Right.
I mean, like telling everyone that I can help, like, because that's what make a lot of people struggle, because they fight against what coming here.
Yeah, and being in the ER, you're in a rush. So I make it a point to like take my time with patients, even though I'm moving quickly. I'm still asking like key questions. I'm still connecting with them, because I think that connection is important. Somebody might come in. I had another patient 2 days ago. She came in, chest pain, arm pain, leg pain, and one would think heart issues, clotting issues. And yeah, I'll do the test for that. But I sat and I talked with her and I realized it's emotionally driven. She's under stress. She's getting help from work, her husband, her kids. She's stressed. Her tests were normal. Yes, we do it all. We look for everything. But just sitting and talking to her, by the end of her visit, her hearing that everything was okay, but also her being able to talk to me about what she was going through made her feel better.
Wow.
So I feel like God put me here.
So that's more than being a doctor. That's everything in one right there.
Yeah.
Not everyone get that.
Yeah.
Not everyone get that.
Yeah.
People don't understand.
I definitely understand that, especially if you're going against the grain of what you feel inside, like the intimacy you talked about.
Yeah.
So going against that grain, you feel it.
Yeah, it'll bother me. Yeah.
You spill out into your life slowly but surely until you like, I really am backtracking.
Yeah.
I've been feeling it, but I'm going against it, and now life is telling me, you're messing up, right?
That's right. That's
Gotta
right.
change that.
Yeah. Always listen to yourself. Yeah.
Another thing
Ooh.
is in your practice though, is there anything in your field or dealing with the hospital, dealing with medical care that you kind of want to see change in policy? Any change you want to see going forward and how patient care is handled?
Yeah.
And things like that? Like,
absolutely. I think like at the simplest level, follow-up care is difficult. So like we'll see patients in the ER and then depending on what we find or don't find, either way we would like for them to follow up with someone, right? And that's the challenge. People come to the ER and they view the ER as their primary care provider. Any issue they have, there's no doctor that they would make an appointment with to go see. They just go to the ER. And unfortunately in the ER, that's what we do is we look for emergencies.
Of course.
But not every medical problem is an emergency. It needs attention, but it doesn't need the emergency room.
Yeah.
And there's but so much we can look for. And after we do that initial emergent workup, if everything is normal, and we say, even though everything is normal, you should still, I don't know, follow up with your cardiologist, right? You might need a stress test, an echo, things that we won't necessarily need to emergently do. People don't follow up. So that could be in part because of access to care, albeit insurance issues. It could be ability to pay. It could just be even citizenship. It could be so many things that people are afraid of and don't want to seek that kind of care. They'd rather just go to the ER, but so many things could still be missed. So
some of it is fear
level,
too.
it's an issue.
Some of it is fear, some of it is ignorance. People gotta understand that you gotta educate yourself. There's a lot of people that are going through a lot right now because of the Trump immigration. There's a lot of people going through a lot of stress. Yeah. But what they need to understand, they need to know that there's a law. There's still a law. You know what I mean?
But health literacy is important, and I feel like also the lack of understanding. I'm not saying you have to have medical school level knowledge of your body, but just basic understanding of when something could be wrong and when you need to seek care. That's why I have my platform as well. I explain to people, it's not just about identifying when there's a problem, but it's about prevention as well. And that's why health and wellness is important.
Wellness, you hear it?
Before you even
health
get
and
there.
wellness, very, very important.
Yeah.
I could be wrong, I could be mistaken, but sometimes it feels like, especially for the minority community like us, that we don't feel comfortable going so much to a private physician. We may not get the care that we think we'll get going to emergency room, because then it's like you have to see me versus like the doctor at the office will take his time and not really care about my records like that. So if I come to the emergency room, I feel more likely that I would get emergency treatment on my situation, even if it's something as simple as a common cold, versus just going to a doctor who's telling me like, oh yeah, you're fine, just take 2 Advil PMs and you'll be okay.
Yeah.
That's how true it is. That's how true it is.
Not,
That's how true that is.
Why does that feel like not just your building, but maybe like
it's
the
an
area?
Not every doctor, like she tell you straight up though, like not every doctor think like doctors. She think more than a doctor. You gotta understand that, because what she did for that lady wasn't what doctoring.
Right.
That was her calling. She was choose to do that.
That is
That's-
true.
that-
That's the intuition of a great
Of course,
doctor.
Right.
of course,
Didn't brush
of course.
it off because
Right.
of-
You have that experience. I have that experience with doctor. I'm looking at the doctor like really?
Yeah.
You just say that?
Yeah.
You not even ask me how I'm feeling. Like you're
Yeah.
just like, okay, test.
I can't lie. I have that fear if I'm being honest. Like I know what I deliver to others, right?
Yeah.
But I also fear what others will deliver to me. Like when I'm in the care of another provider, am I going to get the care that I know that I can deliver to others?
Like power is out.
Yeah, I think
It's not
the
coming
area,
back. That's crazy.
I think it's like an
It's the first
area
time I
issue.
see that.
Because the street, like you could have seen
Yeah.
outside, like. Mm-mm.
That's crazy. You hear the horn? Welcome back. Remember, guys, please like, share, and subscribe. Bring someone to the community, please. You know, it's a people's podcast. It's a Nothing to Fear podcast. We're about the community. We're about upliftment. We're about the people. You know what I mean, we're about striving for better together. And we're here with the beautiful, stunning Dr. Shari and MD. Don't forget that. Okay, was writing a therapeutic for you, or was it more like a professional endeavor?
This was like journaling on steroids.
Oh man!
No, seriously,
Yeah.
like think about what happens if you journal, right?
Yeah.
You reflect on your day or whatever it is you're writing about,
Yeah.
and going back and remembering my story. It's just not only just writing it, but like emotionally feeling connected to it again. It brought those emotions out. So when I say journaling on steroids, I mean it.
Yeah.
I think that everyone should be writing, even if you're not publishing, write.
Right.
Because that reflection, not only does it help you to process what your experiences were, but it helps you to analyze it in a different way or appreciate it in a different manner, because you might not, through living it like in that moment, understand it the same way until you look back. So it was heavy. It was heavy because I cried oftentimes just thinking about my story, thinking about the struggles that I thought this was the end. Like there's no way I'm coming out of this. And then seeing and writing that I came out of it and realizing, you know, the growth through the struggle. That's what it was.
And if you're not writing, you should be reading.
Yeah.
You know what I mean? Like, you know what I mean? You should also educating yourself, regardless. You know what I mean? So, what do you hope readers take away from your story?
Yeah, I hope that readers realize that they're not alone. I hope that somebody identifies with, even if it's one part of the story, I'm hoping that it helps somebody, even if it helps one person, but in a small way. It doesn't have to be anything major, but I do want people to pull how you can thrive through self-discovery, how you can thrive through just understanding, you know, where you've been and what you want for your life, creating purpose, finding alignment. I'm hoping that people can pull from that.
Yeah.
Yeah.
I'm gonna ask you these questions. Beginning your career as a doctor, working in the field as a black doctor, what are some of the struggles that you face back then, and what is the changes that's happening now?
Yeah, you know, it's interesting because there was a handful of black resident physicians. I was one of maybe 2 or 3 within my class. And then in medical school, we really didn't make up a large percentage either. One thing I do know is that we stuck together. We helped each other. But part of the struggles includes just feeling seen, not being called a nurse.
Yeah.
You know, and we love our nurses, but I feel like, you know, there's an assumption when somebody sees a minority individual walking the halls of a hospital, white coat or no white coat, automatically I'm either housekeeping, the nurse, you know, I'm somebody, but not the doctor.
Not the doctor.
Right? Everyone's important in the building, but I'm not the doctor, right? So it's just pushing through that stereotype that people have, that unconscious bias that people hold. But once I open my mouth, once I do my work, once I demonstrate my craft and my skill and my education, yes, it's that. It's,
Of course, it's that.
Yeah, yeah. And then even though it's accepted, I still get phrases such as, your parents must be so proud. But do you tell everyone else that? So I just say, they are, they
Of
are.
course.
But I have a feeling like that
Yeah.
all stems from, again, another
For-
unconscious
of
bias,
course.
right? Of course my parents are proud,
Of
but
course.
everybody's parents
Why
are
would
proud.
you remind? Why would you even remind me about that?
Right.
Of course.
So I accept it with grace,
Of course.
Yes, of course they're proud, but in the back of my head I'm just like, okay.
It's the world we're living in, right?
Yeah, unfortunately.
It's sad, but it's the truth.
Right.
Yeah, unfortunately.
Yeah.
So we're gonna touch a base of businesswoman, and slash you have your own brand. Let's touch on that. Tell us about your business and what brought you, and how did it all begin?
Yeah, so before I went into med school, I was a person, I used to model. I used to do this show, we called it Urban Overdose, on BCAT, if you guys remember BCAT
Of
back
course.
in the day. We used to interview artists, Shaggy, Egyptian.
Word.
I mean, it was a time, right? I was into cars. I used to race. I used to soup up my car. So I'm talking lower the car, full sound system.
I remember you used to pull up on the shop
Listen,
with a car tailpipe blasting.
all of that, and I had a good time. You know what I'm saying?
Of
Like
course.
I had a good time, and I also had community in that. Like I was part of a car crew. Like it was just everything was hustling and bustling. But then I said, I'm going to med school, and I can't keep all of this up. It was hard. I couldn't keep going out. I couldn't do all the things. I had to put a lot to the side in order to focus. Because that was my priority, was my goal, and I had to make some decisions. But then I ended up getting pregnant by the last year of med school, having Colin right before I graduated. And remember, I put all those things still to the side, but now I have a child, and now I have a title. And I fell into that. That's fine. I'm doing what I meant to do. I'm a doctor now. I'm a mom. Wow, But I got rid of the car because I can't have my son in the back of a low car going like this with a loud sound system and muffler, right? Or an exhaust. So I put a lot to the side, and that's fine. But then I realized I was in a routine, and it was mundane, and it was just home, work, kid, home, work, kid. And I wasn't doing anything that was fulfilling me. So I had to find myself again. So fashion, one of my passions from before in modeling, I decided to build a brand in fashion called Statement Piece New York. It's a fashion clothing boutique. I actually, through doing that, began to hustle a little bit in designing. So I started to create some designs. I was featured in New York Fashion Week one year. And then I realized, wow, when you really focus and put like the time and effort and work in, things start happening, and then same, like mundane, everyday work, home, do the fitness. I started working out. I started enjoying it and seeing how it made me feel. So now, aside from the fashion, I'm also into fitness. And then I said, wow, I could help others. So why not do that? And that's how my other brand, Peak Pulse Health, has been birthed, is through that joy that I found in fitness and my will to put that onto others. So that's where the serial entrepreneurship comes from. It's because I'm finding the need and seeing how I can be of service, and then pursuing that. And then authorship came through all of that. Right?
So
full
becoming
circle.
the story.
So it sounds like different. Fashion, what? Fitness?
Everything comes
medicine? Wait.
all comes in
but
together.
It's coming together. And that's what I call alignment. I'm not like all over the place. And when the season comes, I know how to bask in that season. But it all comes together. It all works together.
I can tell you, reading the book, again, it's telling me that you're very connected and your energy is high, and you're putting on people until stuff that you experience, that help you to grow into the person you are today. So I have to tip my hat off to that. You know what I mean? It's caught me, and I can encourage all the male out there, the men out there, go support her book. It's a great read. You know what I mean? So what set your brand apart in a crowded market? What set it apart? Like
Yeah.
we're in New York. You know the vibe.
That's where personal story is important.
Yeah.
Because everybody could have a clothing brand,
Mm-hmm.
right? But if you know the story behind it and you can identify with
Yep.
that and you respect it,
Mm-hmm.
that's what sets you apart. It's who is the brand? It's the personal brand behind the brand.
Brand, of course.
So people will say, "Oh, I can't do this business because everybody else has it, or there's too many. The market is saturated."
You're not supposed to be doing it then.
Listen,
You're not supposed to, if you don't have a story, make sure that story come out in whatever you do. It don't have to be a brand. It could be, you could be a daycare owner. You know what I mean? You make sure the story comes out, because that's going to compel people to follow you and to support you.
yeah,
You know what I mean? And everybody have their crowd.
yeah.
So what were some of the early mistakes you made in business, and how did you grow from them?
That's a good question.
Yeah.
I mean, I could think of a few, but I think the one that hits me the most is that you can't do it all alone.
By yourself, right?
You know, yes, it was on my heart to formulate the fashion brand,
Mm-hmm.
but then I realized I can't do this by myself.
No.
So hiring help, finding support, just tapping into resources is important. So I think that was one lesson learned for sure. So I wouldn't advise, people, yeah, in the beginning you might start off by yourself. You want to get to learn the lay of the land. What are you doing? Come up with your plan, have your strategy. But don't be afraid to tap into resources for assistance, for sure. So
Of
that's
course.
a major lesson in business.
Of course. I can say that too. It's
Yeah.
not my interview, it's yours. All right. We're gonna take back your journey overall. Looking back, what has been your most defining moment?
Having my son,
Yeah.
I think that trumps everything. Unexpected it was, I have
Yeah.
to say, but I think that definitely has been my most defining moment, because that's where I think I've grown the most, I've learned the most. And if it weren't for the struggles that I felt that I faced during the time of early motherhood, I don't think I would have found myself back to all the things that I've enjoyed. Maybe I would have, maybe I would not, I don't know. But I think that the trajectory of my life, the pivot is all around Colin,
Of course.
all around him.
I know that.
Yeah,
100%.
absolutely.
Yeah. What advice would you give someone who's trying to wear multiple hats like you? What advice would you give them?
Yeah, I think it's one at a time. Find what season you're in for that moment and focus on that. Don't, what's the word? Scatterbrain. Don't have scatterbrain and say, I want to do this, I want to do that, I want to do this. Try to focus, build one thing at a time, and just realize, okay, I'm in this season and I'm just going to focus on that. It's not about balance, it's about alignment. So,
Of course.
just keep focused on what your first goal would be. Create a list, write it down, make it plain, and have faith that God created you for a reason. Everybody has a purpose, and that one purpose can guide you in all the directions you need to go. You just have to take it one step at a time.
Amen. And I know you have an event coming up. Do you want to elaborate on it a little bit and let the people know what's going on?
Yeah, well, I'm going to have many events. This one is packed to capacity.
Yeah.
God is good.
Thank God.
But it's a book signing celebration. It's a book release celebration and a book signing.
I got mine. Go get yours.
Yeah.
Yep.
So this is a major accomplishment. It's my debut book. It's the first of hopefully others. I don't
Yeah.
know. We'll see. We'll speak it into
Let's
existence.
go. Of course. I'm speaking that into existence. Speaking right now.
But it's something to be celebrated, and so I'm having a book release event where it'll be a Q&A. So much like this, we'll have a sit down. We'll dive deep into some portions of the book as well. And, we'll have food, we'll have a good time, we'll network because there'll be a lot of professionals at the event.
Number one.
Absolutely. So that's what's coming up.
You want to be a sponsor? There's space available still. I mean, there's packages. You can holler at her. You can tell them where they can find you.
Yeah. So The Real Dr. Shari. So The Real DrShari on all platforms.
Yep.
Or just go to shariandrews.com and you'll see all of my links there. But more about the sponsorship. The event is Sunday, June 8th. Unfortunately, it's not currently open to the public anymore because we've reached capacity. We're going to have a full house. God is good. But if you're interested in being a sponsor, you can place your brand in front of a room full of important people, VIPs. And if you contact me through any resource you find, if it's my website, my email, Instagram, I'm happy to share more information. But people could find me easily. Google me.
Okay. You could call me and ask me to. I point you right into the right direction. You know what I mean? Let's support the giants and the important people in our community. Please, I'm asking you guys. I mean, go support the book. It's on Amazon. Find your pulse. It's a lot. It's a good read, and it's a lot in there. I mean, if you're struggling right now with a lot of stuff, she could help you right in here. She could help you find your way. And remember, this is the Nothing to Fear podcast. Thank you, Dr. Shari.
Thank you so much.
For turning up. I appreciate it. In your busy schedule.
Oh, man.
Don't forget that.
Thank you.
Busy schedule. So I appreciate you turning up and coming up and supporting the Nothing to Fear podcast. And I mean, I know you motivate someone out there in the Nothing to Fear world today. I'm Blanco Pro. Shout out to my producer over there. Until next time, Nothing to Fear podcast.
Welcome to Nothing to Fear podcast. I go by the name Chris Blanca Pro. I started this podcast to share my untold story, my truths, and my journey, and my close relationship to Jesus Christ. And I want you to create a life on your own terms. We always have a choice. This podcast is about career, hustle, perseverance, manifestation, fun, sport, entertainment, relationship goals, and